morning, everyone. I'm Dr. Ko. I'm from the Department of Psychological Medicine. So I've been given the privilege to introduce our next speaker. So our next speaker is Dr. Lim Po Kuen. She's our new young and vibrant psychiatrist who just joined the Department of Psychological Medicine in the year 2021. So she obtained her master's degree from University Malaya and also her master's in global mental health from King's College of London. So her areas of interest are basically stigma and also wellness, as well as tackling mental health issues in general. So it gives me great pleasure to introduce her, and I hope everyone will sit back and relax and have their breakfast while listening to her talk about the importance of the role of diet in mental health. So without further ado, I'll hand over to Dr. Lim.
All right. Very good morning to professors, doctors, and everyone here for taking your time and joining us today in this webinar. Thank you, Prof. Ko, for the very kind introduction. And while you're all having your breakfast today, let us talk about diet and mental health. So my topic today would be breakfast and mental health. Which of these delicious Malaysian food are you having for breakfast today? So I remember working at the East Coast years ago, and breakfast served there were normally fried bihun, keropok leko, and also nasi tagang with teh tarik. I wonder, when can we consider healthier food option at a workplace? In UMMC, the hospital has a guideline for healthier diet during meeting, whereby food high in fat and sugar content are restricted, and they encourage an increase in the consumption of fruits and dietary fibers. And hopefully with this, healthier diet habits can be cultivated, and with that, the rate of obesity can be reduced. Why is it so important? 10 years ago, Malaysia was found to be one of the most obese countries in Asia, according to a study published in The Lancet. 7 years later, in 2017, Malaysia is still the most obese country in Southeast Asia, and this has not changed until now. This is very alarming because obesity itself has been linked to various mental health issues. And the paper published earlier this year mentioned that Malaysia, which is the country with the highest prevalence of obesity in Southeast Asia, has seen fat and sugar intake increase by 80% and 33% respectively over the past decade. And only a third of the population have ever exercised. So this is critical, and as healthcare providers here today, we can make a change by educating our patients on the importance of a balanced diet and nutrition. It is well known that diet is important to maintain a good physical health, but what is the role of mental health, diet in mental health? So various factors contribute to mental health, and one of it is the social determinants of mental health. These are societal problems that disrupt optimal mental health. It increases the risk and prevalence for mental illnesses, and it worsens the outcomes among individuals with mental illnesses. And this figure here beautifully summarizes the major social determinants of mental health disorders by referring to the Sustainable Developmental Goal. Food insecurity has been shown to be associated with increased risk of adult common mental disorders in low and middle income countries, and inadequate nutrition has been consistently associated with poor cognitive, motor, and social-emotional development in children. So you may ask, how does diet actually affect our mental health? We know that the composition, structure, and function of the brain are dependent on the availability of appropriate nutrients. These nutrients are such as lipids, amino acids, vitamins, and minerals. Hence, food intake and food quality would have an impact on the brain function. Therefore, we can say that diet itself, it can be a modifiable variable to target for better mental health, mood, and cognitive performance. Besides that, there are also endogenous gut hormones, neuropeptides, neurotransmitters, and gut microbiota that are affected directly by what we eat every day. There are cross-sectional population-based epidemiological studies that can provide information on diet and its association with mental health, but they cannot demonstrate the cause, benefit, or remedy. Furthermore, properly controlled diet intervention studies of sufficient duration are lacking, and they cannot demonstrate the beneficial effects for mental health. Intervention studies are often limited methodologically due to the small sample size, heterogeneity within the samples, the lack of biomarkers to adequately stratify within and across the populations, and difficulties in blinding participants and lack of randomized allocations to treatment conditions. But we do have reason for optimism. Why? Because we know that specific nutrient deficiencies or excess in diet may contribute to disease progression. Hence, there is this emergence of the new research field of nutritional psychiatry that offers promising in identifying which dietary components are truly important for mental health. Okay, a very brief overview. What are the current evidences that show that food is important for our mental health? From meta-analysis, a healthy diet, which is described as a diet high in fruit, vegetables, fish, whole grains, is associated with a reduced likelihood of depression. And if you heard of the Mediterranean diet, studies has also shown that it is associated with a reduced risk of depression, and it can confer a protective effect against depression. Another meta-analysis has found that an increased consumption of diets rich in fresh fruits and vegetables has been associated with increased reported happiness and higher levels of mental health and well-being. And when we look at deficiencies in vitamins, what if you don't take a healthy diet and you lack in vitamins and minerals? So deficiencies in vitamin B12 has been associated with fatigue, lethargy, depression, poor memory, and is associated with mania and also psychosis. Deficiency in thiamine has been associated with increased risk of Wernicke's encephalopathy, whereas deficiency in folic acid produces a greater risk of depression during adulthood. Vitamin D's effect on mental health, however, has conflicting results, but there are studies that have shown that higher serum vitamin D has been associated with better attention and working performance in older adults. Some has done study in depression and ADHD, and it has also shown that vitamin D does have some positive effect. Other than that, healthy diet rich in polyphenols, polyunsaturated fatty acids, can also have favorable effects on our mental health, mainly in the cognitive performance, your mood, stress reactivity, and neuroinflammation. So in summary, we know that unbalanced diet itself can increase the risk of cardiometabolic disease, and it can also lead to cognitive decline, impact mental health. It affects the mood regulation and stress sensitivity, and can also lead to obesity. Next, I will move on to talk about the relationship between diet and mental health. This relationship is known to be bidirectional, whereby a change in diet can influence your psychiatric disorders through direct effects of mood, and psychiatric disorders itself can lead to a change in eating habit. Clear association between diet and cognitive and mental health in adulthood have been established, but at present we lack a detailed understanding of the metabolic and cellular mechanism that underpin these associations. So recent evidence has highlighted the role of intestinal microbiome as a key link between the gut and development and function of the brain. Accumulating data has identified the gut microbiota as a key player in the responses to stress and also affective disorders such as anxiety, depression, and cognition. It also plays a role in serotonin metabolism, as well as disease, mental illness such as ADHD, autism spectrum disorder, and anorexia nervosa. And when you're facing stress itself can disturb the gut microbiota and then negatively impact on our digestive health. So a high quality diet may therefore help to regulate the gut microbiota and reduce stress and inflammation in the brain. This would allow the maintenance of proper cognitive function throughout life. When we look at this figure, all the consumption of a healthy diet can lead to the growth of beneficial bacteria. And these microbes can stimulate production of bioactive metabolites, such as neurotransmitters and gut hormones, which can then affect the brain and behavior through direct or indirect signaling pathways. However, consumption of unhealthy diet, usually such as the Western diet, it can lead to proliferation of harmful bacteria. And this gut dysbiosis could result in dysfunctional brain processes and neuroinflammations through alterations in the bowel and metabolism, intestinal permeability, and metabolic pathway. Similar, this figure summarizes what is the relationship between stress, diet, obesity, and behavior. So when you're faced with a large amount of stress, it can affect the brain by affecting our eating and PTSD or depression symptoms. So all these three can lead to a change in the metabolism, metabolic syndrome, and obesity. Again, you can see it's a binary relationship that exists between unhealthy eating and PTSD, depression, and the brain. When there is consumption of unhealthy food, usually there will be a food high in fatty food ingestion. Higher fatty food ingestion can lead to intestinal wall leakiness, which can affect the gut microbiome, and it can also indirectly causes the effect on our mood symptoms, and all these can lead back to obesity and metabolic syndrome. On the other side, you can see that norepinephrine, serotonin, dopamine, cortisol, and the other neuropeptides also plays a role in altering the metabolism, obesity, metabolic syndrome, and then again lead back to our mental health. I'm going to talk about one study, which is called the SMILES trial. It is short for Supporting the Modification of Lifestyle in Lowered Emotional States trial. This is one of the first intervention studies performed to date, which involves a 12-week modified Mediterranean diet. The hypothesis of this trial is a structured dietary support focusing on improved diet quality using a modified Mediterranean diet model will be superior to social support control, termed as befriending, in reducing the severity of depressive symptomatology. So basically, they would like to see that does a change in diet changes the depressive symptoms. It's a 12-week trial, parallel group, single-blind randomized control trial. They recruited 100 over participants, but after screening, 67 participants were eligible, and they were put into two groups, which are the diet intervention group and the control group. These participants are recruited from Australia. In the intervention group, participants were provided with dietary support of 7 sessions, personalized dietary advice, nutritional counseling support, and motivational interviewing, goal setting, and mindful eating. All these are used so that the researchers can support the participants for optimal adherence to the recommended diet. In the control group, they are using a befriending protocol whereby the staff trained personnel will discuss with participants on neutral topics of interest like sports, news, music, and to keep them engaged in the intervention. Both groups completed assessment during the baseline and also 12 weeks after the intervention. And the diet that they used in this intervention is known as the ModiMed diet. It is a modified Mediterranean diet based on Australian dietary guidelines and the dietary guidelines for adults in Greece. They emphasize on 12 key groups, which are the whole grains, vegetables, legume, fish, eggs, lean red meats, raw and unsalted nuts, low fat and unsweetened dairy, olive oil, and chicken. This diet is guided by the PREDIMED study, and it was designed to be easy to follow, sustainable, palatable, and satiating. It provides approximately 2,600 kilocalories of energy per day, And you can see that it is relatively high in fat content, which makes up 40% of the energy, but majority of the fat are monounsaturated fat from olive oil. It's also high in dietary fiber. So in this study, they encourage participants to restrict sweets, refined cereals, fried food, fast food, processed meats, sugary drinks, red wine or white wine consumption, and all other alcohol. Again, this is a dietary composition of the ModiMed diet. 40% of it is made up from fat, followed by 37% of carbohydrate and 80% of protein. So what was the outcome of SMILES? The primary outcome, they wanted to assess on the depressive symptomatology. Hence, they used the MADRS score, which is a score to assess on the severity of the depression. This is measured at baseline and 12 weeks. They also have secondary outcomes whereby they measure anxiety, depression, mood profile, clinical global impression improvement, assess the well-being, and also assessing the self-efficacy. So after 12 weeks of intervention, let's look at the primary outcome, which is on the depression symptomatology. Here, the figure has shown that this group on the left, which is the diet intervention group, showed significant improvement in the depression symptoms compared to the social group. After controlling for the confounders such as age, gender, physical activities, baseline BMI, this between group difference remained significant. And for the secondary outcome measuring on this, it was found that for the anxiety and depression scale, as well as the clinical global impression improvement, these two have shown significantly improvement in their scores. Whereas for the mood state, well-being scale, and self-efficacy scale, these three did not show any significance. Furthermore, they also found out that the ones in the intervention group which received the counseling had significant improvements in the ModiMed scores. So this ModiMed scores is basically a score to show how adherent are they to this diet. And the results from this SMILES trial provide preliminary RCT evidence for dietary improvement in the treatment strategy for treating major depressive episodes. And from this trial, we know that improving diet and targeting depression may be useful and accessible strategy for addressing depression, both in the general population in clinical settings. And this is independent of weight change, because in this trial, they did not emphasize on participants limiting their diet to reduce weight. Despite how much they consume, if they do consume according to the portion that was recommended, their depressive symptoms improved over the 12 weeks. And it shows us that it is important to focus on addressing poor diet in clinical practice. We often emphasize on medications, but diet is one part that we can actually modify and a lot of time overlook. So strategies such as adding clinical dietitians to multidisciplinary mental health teams and making dietitian support available to depressive individuals may be helpful. And not only it will benefit the physical illness, but it also benefit the depression symptoms. So in conclusion, early life development sets the stage for later development and may influence the individual's susceptibility for disease. And accumulating evidence has shown that there is the existence of direct relationships between nutrition, stress susceptibility, mental health, and mental function throughout the lifespan. And future works in the field of nutritional psychiatry is important to focus on scaling up interventions and identifications of the pathways, because all this would mediate the impact of dietary improvement and mental health. Furthermore, novel breakthrough findings on bidirectional relationships between nutrition and brain functioning are urgently needed to inform public health policy on diet. And as clinicians, we should all consider the promotion of better dietary habits for improvement of mental health in our patients, which will then improve the sustainability in our healthcare systems and reduce the economic cost associated with poor mental health. So I would like to end my presentation with this question that I would like to pose for all of you to take a moment to think about. If I improve my diet, will my mental health improve? And if your answer is yes, how can I make the change and modify my diet today for a better mental health? Thank you.
Thank you very much, Dr. Lim, for the very interesting talk. So, are there any questions? So I think if there are no questions, I would like to thank all of you for joining us for the 33rd episode UMHealth, and again next week to find out the latest in the world of UMMC. Thank you very much.